Firstly, I'd just like to say thank you. I'm really, really honoured that we've got 75 people here so far. I wasn't necessarily expecting so many of you to come. I really appreciate it. Um, I will probably start off by just briefly introducing myself. I'm conscious that a lot of us won't have met. Maybe some of us have, I'm not sure. But I think let's start with the topic. So don't forget the staff. That essentially is what I thought of immediately with this title, Learning from Our Mistakes and Professional Humility. I think this is a really important area for us. We can get kind of carried away with our own self-importance and forget about the people who are actually providing the support. It was a much longer title, you might have noticed. And really the kind of key point in the long, lengthy title is that a large part of this presentation is based on a research project that was part of an MA in Autism Studies. So it was looking particularly at staff supporting autistic people. I will explain that more as we go along, but I want to introduce a key phrase early on, which is this study was looking at something called perceived organizational support. Some of you might not have heard that term. Again, I'll explain why that's unsurprising as we get going. But I said I'd introduce myself. So I'm Hugh. I am an associate director at PBSUK. I have, had various roles over the years, but I guess, I'm not going to go into that level of detail, but I guess I just wanted to explain that predominantly those roles have related to supporting autistic people. Generally speaking, my direct experience relates to supporting autistic people who also have co-occurring learning disabilities. But autism is a particular area of interest for me, which is why this talk is going to focus on that specifically. Okay, so not really research based here, but I asked some friends just to share some of the things that they have heard senior managers say within social care organisations regarding the staff. And these things were generally said in a public forum. I think we've got to think about staff's experience and how staff often feel within their workplace. The one that really sticks with me here is that everyone's replaceable comment. And there's some practical reality in that, but we kind of have to think about what that communicates outward to staff about how their organisation perceives them. And I think when it comes to professionals, so I'd imagine most of us are kind of working in a professional role where we're working with staff teams. I think there's a real risk here in terms of us coming across as loftier and holier than thou. And if we're not careful, I think sometimes the message that we can end up bringing across to staff teams is nobody cares, just work harder. Why do I think these things are really, really important? Because of this idea. Every system is perfectly designed to get the results it gets. If we're not seeing good outcomes, if we're not seeing the results that we want for the people that are receiving support, we shouldn't kind of look to who are we blaming. We should think, okay, there's a system problem here. So to put that in more context, and again, reflecting on that holier than thou, I should highlight I get this stuff wrong all the time. All the time. I try and be very reflective and self-aware, but I still go through that process of I've done a really detailed functional assessment and written this beautiful report. I've written a lovely behavior support plan, and it's really, neat and tidy and flashy and wow. I've delivered my training, and I get, a couple of weeks in, a couple of months later, and things aren't going the way we want them to. And I'm surprised. I'm like, well, why aren't they following the plan? What it says, do this, don't do this. Um, I think sometimes we can jump ahead into the more kind of complex approaches, strategies, whatever, without thinking, have we got all of the basics right here first? Have we got the kind of basics around the way that the system should work, the basics around the way that the organizational processes should work? And that kind of leads us into the background of this unpublished research project that I mentioned. So again, thinking about that kind of staff context particularly. So if you look at the state of the sector reports for Skills for Care, they contain some really, really interesting information and some information which should be really relevant to us as practitioners. So looking back at 2022, vacant roles within social care were at the highest level on record. I haven't actually looked at the more recent reports. I would think that has remained pretty similar. The turnover rate within social care is consistently at around 30%. So 2019, 2020, 2021, 2022, round about the same figure each year. What that means for us is that 1 in 3 staff members on average leave their role each year. We've got various studies which highlight to us that stress of the people providing support is related to the occurrence of behaviours of concern from the people receiving support. So I've got a couple of example references here. These Singh et al. Studies looked at providing mindfulness-based interventions to family caregivers. The kind of outcome, the really key message from this, from my perspective, is that nothing was changed with respect to the children who were receiving support. No new strategies, no new ideas. All that was done was mindfulness training for the caregivers. And as a result, you see a reduction in the behaviours of concern. And that is a really important message as far as I'm concerned. The last point then is there's a couple of studies which have identified that burnout amongst staff results in reduced quality of support. That we'll look at in more detail as we go through. Again, before we get into the real detail here, I just wanted us to think about the role of a support worker. And this again it's not evidence-based, it is purely kind of my own reflections. I just took a few moments to think about some of the organizations that I work with, and thought about what the expectations of staff members are in terms of skills and knowledge. And I'd say in under a minute, I'd come up with this list. Um, this is a highly skilled job. It's not only highly skilled, but it's also a really diverse skill set. Our expectations of what people can do and what people should do are actually really, really high. And yet, I would argue that looking at it from a kind of societal view, this is a really undervalued profession. And I think this is also something that we have to take into account. So the pay is not great, but the work is hard. We expect staff to cope with some unusual situations. shall we say, things that you often wouldn't expect to encounter in other workplaces. But I think, again, I'd link this back to that 30% turnover rate, because there's another really interesting point if you dig into those reports, which is, generally speaking, that 1/3 of staff members who leave their role don't leave the sector. So they're not kind of saying, this isn't for me, I'm going to go and get a job in Starbucks or, whatever complete career change. They're actually moving from one social care provider to another. Therefore, I'd argue that it's probably not about the kind of fundamentals, things like pay, because actually your pay isn't likely to change an awful lot if you're staying within the sector. And as such, I would really wonder, is this about working conditions? This is quite an abstract picture, but hopefully it will make sense as I kind of start to explain it. So this is a painting of the Good Samaritan. Some of you might be kind of familiar with that. Some of you maybe not. It's a Bible story. We're not going to kind of go right into the detail because I want to tell you about this study. So it was conducted back in the 70s, and essentially it's a social psychology experiment. It was conducted at an American university's theology department. So the participants, as it were essentially trainee clergymen, so people who were training to work in the church. Now, what the study looked at was helping, so helping others. And essentially, the way that this was set up was to split these trainee clergymen into three groups. So each of the groups was basically presented with a task, which is they were due to present a lecture on another area of the campus. However, the three groups were given slightly differing instructions. So you had one group who were essentially told that they had plenty of time. They were told where to go, make your way over. But you've got loads of time, so you've got set up and prep and etc. etc. You had one group then who were told that you need to leave right now. You're on time, but there's kind of no spare time. And then lastly, you had a group who were told you're already late. The lecture's meant to have started. You need to get there sharpish. On the way over to the building then, each of these groups, each participant would meet a confederate. So essentially someone who presented as being a stranger, but someone who was in distress and needed help. So they were on the floor and clearly kind of presenting as there's something majorly wrong. Why am I kind of going into so much detail? Why am I boring you with this? Because stress impacts upon helping behaviours. The difference in these groups in terms of who stopped to help and who didn't was stark. So the early group, 63% of them stopped to try and help this person. The on-time group, that went down to 45%. The group who were told they were late, only 10% stopped and tried to help. So we've really got to think in terms of this question. We want staff who want to help. We want staff who are compassionate and focused upon providing quality support. Well, actually, staff stress is really, really important to us then. And if we think about this in behavioural terms, fundamentally, we're talking about motivating operations. So I've kind of briefly translated the findings of that study here into a 4-term contingency. And we have the low stress group, that's an establishing operation. We have the discriminative stimulus, the trigger, which is seeing the stranger in need. behaviors, helping behaviors. And then in terms of what the kind of maintaining consequences are, that's specific to the individual, but a lot of this stuff is going to be about congruence with values. So it's automatically reinforced. I'm doing it because it's the right thing to do. If we look at the high stress group, though, we've got an abolishing operation in place for helping and an establishing operation for just rushing. Exactly the same stimulus, but now the predominant behavior that was seen in those studies is walking past, so not providing help. And most likely we've now got a negative reinforcement contingency. So as much as I've kind of put it as avoiding delay, really, I'd say that the kind of real reinforcement here is stress reduction. And again, that is really relevant to us in terms of practice within organizations where we work. Fundamentally, I see this an awful lot of, what's maintaining staff behavior? Stress reduction. They're just trying to get by. Okay. I think a really interesting question, though, and now we're going to kind of dive into the existing literature a little bit on this area. An interesting question for me is does exposure to behaviors of concern alone cause stress? Is stress an inevitable part of our field? And I'd argue no. Several studies have failed to identify a relationship between the occurrence of behaviors of concern and staff burnout. If you look at the studies that are more kind of qualitative or mixed methods in focus, staff attribute their experience of burnout to management issues rather than issues with the people they support. And when you dive into the detail of that, a lack of control in decision making, feeling underappreciated, and long working hours are the really key themes in terms of staff's experience and staff's attributions as to what causes stress, what causes burnout. We're going to look a bit more at the detail then, and really this is kind of focusing on the research that's already been conducted around staff well-being, around staff stress. So we've got some kind of familiar themes here in terms of things that predict staff stress: high workloads, feeling underappreciated, poor quality relationship with their supervisor, a low frequency of supervision, and also role ambiguity, so a lack of clarity about what their role entails. If we look at the opposite, so things that prevent staff stress: social support in the workplace, being able to discuss work and personal problems with a supervisor, fairness, training, practice leadership, and role clarity. Okay, so I got this term in early: perceived organisation support. Why does this matter? So POS was first kind of put forward by Eisenberger in the 1980s. It's grounded in social exchange theory, and essentially what it is the extent to which an employee feels valued and supported by their organization. That sounds important, right? Why am I making a big thing of it? Because I was really surprised by this when I became interested in this kind of area. It was something that I kind of thought, well, staff feeling valued, that is such an important thing in terms of staff performance. If you feel valued by your organization, you want to do a good job, you want to help, you really want to provide the best support you can. Why I think that's really interesting is because actually I started looking for research regarding this and couldn't find any. It wasn't until I found this kind of concept of perceived organizational support that I started finding actually there's a lot of research that's been done around this area of staff feeling valued. However, when you look in our sector, so within the field of learning disabilities, autism, I can only find one study which looks at this variable. If you look at something like hospitality and catering, or if you look at human resources practices, loads and loads, hundreds upon hundreds of studies. And yet within our field, this seems to have largely been overlooked. We've also got to kind of take into account staff factors that will impact upon people's experience of things like stress and burnout. So there are quite a few studies on this, and there's a few of the kind of main areas that have been researched here. So wishful thinking is found to be related to a higher experience of stress. Having a negative emotional reaction to the occurrence of behaviours of concern, so feeling angry or upset, these things seems to relate to a higher experience of stress. And psychological flexibility. So the more flexible your thinking is, the less likely you are to experience high levels of stress. What did we look at particularly then in this study that I've mentioned? So staff supporting autistic individuals who display behaviours of concern have been identified as particularly at risk of negative psychological outcomes such as stress and burnout. Um, we don't have time to kind of go into that, I suppose, but from my perspective, I think it's really important to clarify that that's not kind of labeling autistic people. I often think of this in terms of the double empathy problem. So there is existing research which shows us that where staff don't understand the behavior of the people they're supporting, they experience a higher level of stress. And I think that fits in very, very well with the concept of the double empathy problem in terms of staff struggling to understand autistic ways of thinking. The study, therefore, looked particularly at the relationships between perceived organizational support, trait mindfulness, and emotional exhaustion. So I've given you kind of a really quite a detailed overview of what POS is. Trait mindfulness, so we're not talking about meditation or mindfulness interventions here. We're purely talking about the extent to which staff are generally present moment focused. And finally, emotional exhaustion. We can think of this as broadly interchangeable with the term stress. But emotional exhaustion is one of the three dimensions of burnout. It's been identified as the first stage, essentially. So burnout starts with emotional exhaustion, but also it's predictive of the two other dimensions. And what the kind of study hypothesized was that perceived organization support, trait mindfulness will negatively predict emotional exhaustion in staff. And that brings us to the results. So what did we find? We're not going to go into the detail here. Those of you who are horrified by statistics, don't worry. I'm not going to kind of really go into it, but I do think this is really important. So this study was a correlational design. So basically what we were looking at was those predictor variables. So what level of POS does the staff report when they complete a scale? What level of trait mindfulness do they report when they complete a scale relating to mindfulness? And then the extent to which those two variables predict the outcome variable, which here was emotional exhaustion. So the analysis was a multiple regression, and that's basically looking at the extent to which these variables are correlated. In terms of where the statistics do matter, this third column here is the beta value. So a beta value ranges from 0 to 1, 0 to -1. And all it's telling us is the strength of the correlation. So If you have a correlation of one, those two variables are perfectly correlated. So one predicts the other exactly. If you've got a correlation of zero, there's no relationship at all. Where we've got negative correlations here, it just means that it's negatively correlated. So basically, the higher POS is, the lower emotional exhaustion will be. And the results are really quite interesting. So the kind of key thing to notice is that perceived organizational support comes out as twice the strength of any other variable, more than twice the strength. So when we're looking at mindfulness, that's a decent correlation, minus 0.26, but actually it's kind of dwarfed by that correlation with perceived organizational support. Why does that matter? Again, that kind of same point about we shouldn't be doing the complicated stuff. We should be focusing on the simple stuff first. There is loads of research now, particularly again the Sing studies, which shows that mindfulness interventions can be really, really effective in reducing staff stress. But again, I'd argue we need to get those organizational systems and structures right first, because if we don't get those kind of simpler things, the basics in place, it's unlikely that more complex approaches, more complex interventions, strategies, whatever we call them, are going to be effective. I mentioned that we don't have a lot of research within our field regarding perceived organisation support. Um, so in some respects, that means it's difficult to kind of say, this is what you need to do, this is what you shouldn't do. But we can look at the research that has been completed in other sectors. So this is all drawn out of a systematic review from 2002 regarding perceived organisational support. So where perceived organisation support is high, where staff feel really valued and supported, we see reduced stress, emotional exhaustion, we see higher work engagement, increased motivation to learn, and increased motivation to improve work performance. Where staff report a low experience of POS, so where they feel unsupported and undervalued, increased risk of emotional exhaustion or stress, impaired staff well-being, increased absenteeism, and increased intent to leave. If we don't value our staff, this is what the research shows us. We're going to have people taking more days off and searching for other work. Most importantly, I think we shouldn't be thinking of that purely in organizational terms. We need to think about it in terms of the people that we're supporting. So if we want those kind of functional assessments to be meaningful, if we want our kind of beautiful, pretty plans to be implemented and to affect on practice, higher work engagement, increased motivation to learn, motivation to improve work performance, those things are really, really important. Really, really important that staff teams have those motivations. But again, thinking of the people we support, particularly for the people that I support, relationships are really, really important. Again, this comes up a lot in the literature relating to autistic well-being and the needs of autistic people. Relationships are key. It's hard to develop relationships if people are constantly chopping and changing, whether they're actually present in the workplace. It's really damaging if the people that you're forming relationships with are constantly leaving their role. And that's something that I think is really, really tricky for us. And I think it's something that we really should think about in terms of the impact on the people that we're supporting. I've mentioned this previously, but again, I think this is also really, really key for us in terms of thinking about some of the research within our field. So it has been identified that staff burnout results in reduced quality of support. So again, we're talking about an impact on the people that we support. But to put it more eloquently, we've got this quote here from David Petoniak. I'm not going to read the whole thing out. So I'll just kind of pause briefly whilst everyone has the opportunity to read it. But I think just that last quote summarizes it for me. When people do not feel supported, when they feel afraid, they have a difficult time being supportive. And it brings us back to that Good Samaritan study, really, which is fundamentally we've got to think of stress as a motivating operation. If we want people to be helpful, if we want them to be compassionate, then actually we've got to think about their needs as well. This, in some respects, is hypothetical. I say that because, it's kind of a bit of a jump from the research that I conducted. But each one of these relationships in this overall cycle, there's a good body of research which supports that relationship exists. So really, it's just about bringing all of the different pieces of research together to create what I'd see as really a vicious cycle. So, the study that I've been talking about showed us that in services where staff are supporting autistic people who engage in behaviours of concern, where there are low levels of perceived organisation support, it's likely that staff will experience an increased level of stress. We have pre-existing research which shows us that stress and burnout are related to decreased quality of support. What do we know about decreased quality of support? That is related with decreased quality of life for people receiving support. That is something that has been researched heavily within the kind of area of active support. Finally, if we look at the kind of work around capable environments, we know that where people have a decreased quality of life, they're much more likely to engage in behaviours of concern. And if we're not careful, this is a cycle that just goes round and round and round. Could be quite a depressing talk, couldn't it, if that's where I left things. I think really what we've been leading up to is, what do we do about this? How do we try and change things? And again, for me, it kind of links back to that there isn't enough research. Perceived organizational support just doesn't seem to have been researched thoroughly within our field. From my perspective, as you'll have picked up by now, this is really important. Nobody knows. If we don't have the research, fundamentally, it's hard to be kind of really clear. This is what matters. This is what's going to change things. But we can look at the research in other sectors, and we can also look at the research that's been kind of relevant within our field. So actually there is a lot of papers on, what causes staff stress, what causes burnout. There's some that look more at well-being more broadly. But the kind of key principles that Rhodes and Eisenberger put forward in terms of what contributes to perceived organizational support, fairness, support from leaders, human resources practices, and working conditions. In some respects, though, I'm not convinced that's specific enough. I think it's good to kind of look at things that are a bit more concrete. And so basically, I took a look at the literature from our field, and try to identify what some of the really likely variables are. Effective support from supervisors. This comes up a lot in the literature, and I'm going to kind of break these things down a little bit more shortly. But what I would say is it's not as simple as the frequency. It's not, we can't treat this as a, yes, we have supervision in place, but it's a bit of a tick box exercise. You know, it's not as simple as it just happening. Training and development, role clarity. So people knowing what their role is, what they're meant to be doing, what's expected of them, and leadership. Okay, support from supervisors, quality and quantity. We can't look at one and ignore the other. It can't be that you have really good supervisions, but they're only once a year. But equally, it can't be staff get a supervision every week, but actually they don't take anything away from it. I really like this second point. So this study picked out that actually it's not just about getting really good supervision relating to your work. They found that staff reported lower stress where they felt they could take both work and personal problems to their supervisor. And that's really, really important from my perspective, because again, that speaks to that concept of quality. You know, what is the quality of that relationship between staff member and supervisor? That point that staff attribute stress to management issues and not the people that they support, I think is really important. Again, both in terms of where we situate the difficulties that staff are experiencing. This shouldn't be something that we situate within the people that they're supporting. Fundamentally, that isn't going to be helpful, and nor would it be fair. But actually, it's looking at the overall context and kind of thinking in terms of this is a product of that system. I also really like this study, which was conducted in an ABA school. And this wasn't about frequency of supervision or quality of supervision sessions. It was actually about staff perception. So if staff perceived a high level of support from their supervisor, they experience less burnout. So actually, how staff feel, you know, I look at it again, it's a bit sort of vernacular, but feeling that someone's got your back. And again, going back to that, there's no kind of clear relationship between the occurrence of behaviors of concern and the experience of stress. It's something I can really relate to. You know, often within my work, whether it was providing direct support or as a practitioner, it's not necessary that I've needed hand holding. It's more that I've felt the need for, yes, if this goes wrong, I know that my supervisor will say, that's not your fault. You tried something good, didn't work out. That's okay. Let's talk about it. Let's figure something out. Where staff are likely to kind of feel that blame or that support is lacking, that's where I think we're going to see a much higher level of stress. Training and development. So I think just broadly, you know, for me, training and development reflects an investment. So in terms of that staff feeling valued, that's important. Exactly the same as with the supervision, though. It can't be tokenistic. It can't just be you've had your induction, that's your lot. This has to be looked at as an ongoing process in terms of the organisation showing we do value you, we do want you to stay, and we do see this as a genuine career, not a stopgap. I mentioned previously in the context of the double empathy problem that staff experience a higher level of stress if they don't understand the behaviour of the people they support. Well, good training is really important to that. You know, if we're talking about autistic people, a real focus upon training that gives staff a really good understanding of autism. I'd also say, from my perspective, it's really, really important that that includes looking at the experiences of autistic people and a kind of autism from the inside out. But also thinking about it in terms of our roles, good understanding of things like behavioral functions, good understanding of motivating operations and discriminative stimulus, you know, so setting events and triggers. Why? Because I think often people end up focusing too much on triggers and not thinking enough about motivation. And that does make things unpredictable. You know, if you're not thinking about what motivates people to engage in behaviors, then often, I should say, behaviors of concern, then often they will seem that they've come out of the blue. And I think it's that unpredictability which is going to be very, very difficult for staff. And this last point I've already mentioned, but again, we shouldn't look at this as induction only. You know, it's about that kind of ongoing support and development. Leadership, this is a really big area for us. I think it's important to be fair here because if we look at the literature regarding practice leadership, you know, we can see how important this is. Practice leadership is vital in terms of the outcomes for the people receiving support. But I think sometimes it comes across as a little unfair on managers or senior leaders, just in terms of, well, is that their role? You know? And often I'd look at it as actually a practice leadership role is going to be more a sort of frontline position. So often it's likely to be more kind of senior support worker, team leaders, etc. Where am I going with this? If we're talking about someone whose role is predominantly administrative, that's fine. You know, I wouldn't expect them to actually be working outside of their kind of job description, but the alignment with values part is really, really important. You know, demonstrating and modeling a commitment to what's this all about? This is about getting good outcomes for the people we're working with, really improving their quality of life. From my personal experience, as soon as an employee, you feel like this is all about money, that kills motivation. Modeling is really, really important. There is a wealth of research on practice leadership showing that this results in better outcomes for people receiving support. What there also is some studies which show practice leadership has a really significant impact on staff outcomes too. So there's studies in 2014, 2019 by Roy DeVoe and Peter McGill. The 2019 study in particular is really relevant because it showed that where there is good practice leadership in place, it results in higher job satisfaction and lower experience of stress for staff. And I predicted my own point there. Okay, role ambiguity and role clarity. There's a lot of research about this. I'm not going to just kind of read the bullet points, but fundamentally knowing what is expected of you, knowing whether or not you're doing well, knowing that you're kind of doing the right things, all of this stuff has a big, big impact on staff stress. Um, and I think rather than kind of talk about the research here, I'm just going to link it back to a more kind of personal example. And hopefully you can all relate to this. But, you know, do you know that feeling of like first day in a new job and you just don't quite know what's allowed, what's not allowed, what you're meant to be doing, whether you're doing it right, you know, I mean, I know I'm entitled to a break, but when do I take it? Where do I go? Do I have to tell anyone? Do I have to ask permission? All of that stuff, it makes me really anxious. I don't cope well with ambiguity at all. I like to know exactly what's expected of me. And again, you know, I think this is really, really key. It's something that Gary Lavinia talks about a lot. The staff like feedback. You know, we don't like to be left in the lurch, kind of figuring out for ourselves that we're doing the right thing. Obviously, there's clear links there to practice leadership in terms of getting that coaching and mentoring and feedback on the shop floor. But I think that is really, really important. Um, and this is the last slide. So we'll move on to questions shortly. Not doing too badly for time. I'm approximately right. But I guess I wanted to finish with this phrase, and it's a quote from Damian Milton. It was from a paper in 2014 called something along the lines of what are autism interventions intervening with. And he puts forward the idea that any intervention um, with autistic people should be focused on reciprocity and mutuality. And I love that idea. It really resonated with me. But I think here, I think there's a parallel in terms of actually what's important for the people receiving support is also important for the staff. So I think that concept of reciprocity, i.e., you're not just a cog in a machine, we're actively engaging with you. And, we do see this as a give-take relationship. I think that's important. And again, a similar concept in terms of something that I think has been a criticism from the autism community at times or for certain sections is this idea of doing to, not doing with. And I think that's really, really valid and really, really important. And I think within our work, that whole concept of professional humility is really important. That actually we're thinking about those power dynamics. And we're not looking at it in terms of this is what we're doing. We're looking at it as this is what we're doing together. Same with the staff. I think there's a kind of parallel of experience here. And a really important point to clarify that just pacifying people, just being nice to people, I personally don't find results in good outcomes. If we're looking at the people we support and just trying to keep them happy, I don't tend to find that results in the best outcomes. But I think exactly the same with staff. So what I'm not saying here is just, try and make your staff happy above all things. Because actually, again, thinking about that parallel of experience, if we look at active support, what are the kind of key principles in terms of the outcome measures? Engagement and relationships. That's where we're focused. And again, I think that is also important in terms of, well, what should organisations be focusing on with their staff? Well, exactly that. We should be focusing on good working relationships, good relationships with supervisors, good working relationships between teams, but also a focus on engagement. Because again, in terms of job satisfaction, concepts such as that, which I'm again sure will be related to perceived organisational support, generally speaking, my experience of that is where you see really happy teams. It's where they're seeing good outcomes for the people they're working with. Fundamentally, it's not that people don't like working hard. People often do, I think, but they like seeing that engagement being recognised and seeing it producing those outcomes for people. Okay. I will just briefly show we've got lots and lots of references. I'm not expecting everyone to be scribbling these down furiously, but I did just want to draw your attention to one because I found this really, really helpful. If you're interested in this kind of area of research, this last study here, Ryan, Bergen and Wells, 2019, it is a scoping review of studies which have looked at the experience of staff in terms of well-being, in terms of stress. Because it's a review, it contains a wealth of other studies, but it is really, really helpful from my experience in terms of just providing an overall summary. Okay. So just let me stop sharing and I'll come back to the room.
Thanks, you. That was incredible. Really interesting.
Great. Should also say, I think it's quite clear I'm having problems with sunlight. It's a beautiful sunny day here, and I can either sit in the shadow or sit in the sun, or kind of half and half and have a strange profile. But thank you, Sandra.
I think it's such an important topic, and I think we focus on the individuals that we support so much, don't we? And it really is integral, I think, to support the staff team as well. And as Gemma said in the comments as well, just around system-wide as well, making sure each individual at different levels gets that support as well. So supervisors and managers also get that support.
Great. Yeah, again, I'd kind of link that back to that idea of mutuality and reciprocity, which is we're thinking about the system's needs and not just one particular part of the system. But do we have any questions?
We have got some comments at the moment. There are no, we've got one question about your Blue Peter badge. I was wondering what that was.
That's the one thing that people have been interested in. What's the question about, Sandra? What do they want to know?
Um, what have you got your Blue Peter badge for? From Stephen.
So I don't know. I don't honestly remember how old I was. Maybe 6 or 7, and I got my Blue Peter badge from writing about my favorite museum.
Amazing.
How cool is that?
Really cool. Um, that's very cool. Amanda in the chat has given some lovely examples as well about how they're implementing sort of staff wellbeing meetings and um, I was going to read the whole thing out again. They're implementing and having a positive impact on workforce. They're rota planning staff wellbeing meetings, so they have a platform to discuss challenges, experience, and emotions in a safe place, avoiding toxic positivity and allowing them to say this in a hard, like, yeah, when things are difficult, I'm struggling, which is really, really important. And I think having that psychological flexibility is really important, isn't it, in the workplace? The second thing that you're working on is the self-awareness of how emotional disposition and stress level directly impacts the service user. We use a thermometer check-in for each staff member to recognize when they're where their well-being is on a given day. And therefore, sorry, bear with me, what additional peer or management support they may need, for example, more breaks or change of face, etc., and helping them understand co-regulation versus co-dysregulation with service users. It's very early days for us, but implementing these strategies, but so far the staff feel better supported, which sounds incredible. Thank you.
Great. And there's loads of good stuff in there. I was trying to keep track um, because otherwise I'll kind of go off on a tangent. But there's one thing in there that you mentioned, which I think is really important, and I sort of hinted at, but didn't maybe elaborate on, which is that kind of toxic positivity. Now, I think there's probably a few different things you're talking about there. Like one, when people are having a rough time, telling them to be happy. Well, that's not very helpful. But I guess the other thing that it just brought up for me is that kind of idea that engagement with your staff is just about saying good job, everyone. And, kind of wandering around, just being like, you're doing great, guys. People see through that stuff. And I'd link it to authenticity. And again, in terms of that mirrored experience of people receiving support and the experience of staff, it makes me think of some of Greg Hanley's stuff because he talks about this in the paper on today's ABA. He talks about how important it is to be authentic with the people we're supporting. If you're not impressed, don't comment. Don't say anything. Don't offer stuff without being asked for it. And I think for me, that kind of resonates again with that idea of staff feedback being really, really important. But I do think authenticity is really important because, as much as anything, if it is just kind of, insincere attempts at just saying, oh, good job, guys, because actually people need positive feedback, that's not going to be effective. People don't value it. People really value it where it is authentic, where they can see they genuinely meant that. They saw what I'm doing and they think this is really good work. So I think that's a really important point.
Definitely, thanks you. We have a question from Jane. We rely on school staff to support gathering data and implementing strategies, but these are one-off pieces of work, if attempted at all. Are there any good examples of education placements that invest in PBS, and overall, what are the outcomes?
A big question. um, okay, I'm going to try and relate that back to the topic, I think. in terms of, you know, firstly, what you mentioned was that ask from staff. And again, whether we're working with staff teams or whether we're working in a smaller system, you know, a family home, a lot of our work has been in family homes. But I always feel like that actually the first thing that I do, you know, we get a kind of referral or ask for help. First thing I do is generally add to people's workloads rather than reduce it. You know, and it's that kind of starting point of nobody cares, work harder. Um, and that's something to be really mindful of. And sometimes I think it is helpful rather than starting off with, okay, you're telling us that you've got a young person who engages in these behaviors of concern. We want some data from you. Right, here's all these recording systems. You need to do all of this, and then we'll help you down the line. Starting off more with a let's have a chat about it. You know, what's this like for you guys? What do you need help with? What are you finding difficult? Because actually opening up those conversations early on isn't just kind of, you know, that sort of compassionate approach showing that we care, but actually it can help you identify some really, really important information, really important information that often relates to contextual fit. You know, fundamentally, why aren't my beautiful PBS plans and my functional assessments and stuff having the impact that I want? Because I don't have contextual fit. You know, if we're talking about a family or if we're talking about a staff team who are totally wiped out and feel like their needs are completely disregarded, well, we don't have contextual fit, so it's not going to be helpful. But starting with that kind of let's have a chat about how we can help, I think is going to be much more constructive, and or it will provide you with useful information to inform, you know, how you're going to approach whatever difficulties it is that the team are experiencing. Yes, there is lots of research regarding systems-wide implementation within school settings. If you look at George Shagai is the name that comes to mind straight away over in America, and more broadly PBIS, and they've even done quite a lot of studies looking at statewide, so not even just school-wide, but statewide implementation of positive behavior, positive behavioral intervention and support. Again, there's kind of a wealth of research on that, but sticking with the kind of focus topic here, I'd say start off with some open-ended conversations with the people providing support, and use that to inform what is going to be kind of helpful. Okay.
Thanks, you. I think we've got one for questions. It's been quite a similar question, so I think you've answered that in the last section, Hugh. Thank you.
Great. All right. In which case, thank you so much, guys, for attending today. Really appreciate it. And I hope you all enjoy the rest of the day.